Welcome to this week's Wednesday Wellness Minutes. This is Dr. Schilling from Sequoia Health, and today I have Sasha with me. And Sasha was complaining about some neck pain earlier, so I want to give you kind of a inside look as far as how we evaluate neck pain and give you some information about how you can get to the root cause of what's actually causing your neck pain. So first of all, we asked Sasha, in this case, she's not a patient, she's actually one of our team members. We're going to ask her what kind of pain she's experiencing, so I'll let her tell us that, like positions and movements and how long has it been bugging you.
Yeah, when I turn my head or when I go up or down,
Okay.
mostly.
So pretty much any position.
Yes.
Okay. All right. That's not helpful, especially when you're trying to drive, look over your shoulder and things like that. All right. And how long have you been noticing it?
About a couple weeks.
Couple weeks. All right. This is the first I've heard about this, otherwise I would have fixed it by now. All right. Very good. So what we're going to want to do is understand that first and foremost, what is controlling the neck are the muscles. All right. So if you try to adjust neck pain out of someone, like many of my colleagues do, chiropractors, you're not going to go wrong. They're going to get pain relief because you're going to stimulate what are called the sensors in the neck, the mechanoreceptors, which is the fancy word for just how your brain picks up the information from the neck. What you want to do is, first of all, understand that the muscles move the bones. Chiropractors move bones as well, but muscles do it better than we do. So what we want to focus on is the neurology of the muscles and why is the brain telling them to hold them in that position in the first place. So first and foremost, we're going to check the core. Now, most of you, if you raised your hand and I asked you which one was the core, you'd point to down here, right? The midsection. You actually have two cores in your body. You have a midsection core and a neck core, okay? So what we're going to do is first and foremost check her core strength. Now, what I'm going to have her do is turn her head and then drop her chin down, and I want you to resist me. I want you to hold your head there, but first of all, we're going to flip your hands up so you don't try to cheat with your shoulders, and you're just going to hold your head there and then don't let me push. And just use as much force as you have to stop me from pushing back. Now, how hard are you trying? Pretty hard?
Yeah.
Okay. Hold your chin down there. I know this may seem, hold your head down there, no? Okay. What you'll notice is no matter how hard she tries, and you'll hear my voice, I'm not straining, and she's fighting very hard, okay? But it's not holding, which is a sign that the muscles are disengaged, like they're not connecting well with the brain. So that is her core, which if the neck flexors are weak, the whole head's going to be a problem. And if just posturally, when you observe this young lady when she's sitting there, she has a tendency to that forward head carriage, which is very common among a lot of people. Sasha has the great fortune of being mobile around the clinic, but she does spend some time at the computer, and therefore it's going to be a lot of chin jutting, a lot of forward head posture. For every inch your head comes forward, it doubles the weight of your head on your neck. So if you have a 10-pound bowling ball on your head as a head, every inch forward becomes 20 pounds. That's a lot of strain on your neck, which then ultimately causes the shoulders to come up to brace so your head doesn't go toppling forward. Therefore, we now know that she has some neck weakness. We can check the back now. We can have her extend her head back, look up at the ceiling, and then have her hold her head there. And I don't want you to let me move you. Just hold there. And I can apply quite a bit of pressure, and she holds just fine. You felt that was perfectly good, right? Tipping your ear to your shoulder. And we'd always ask, is there any pain here down this side? Do you have any pulling here or pinching here?
Pinching here.
Pinching there, okay. And I'll have you hold your head to that side and don't let me push. Good. Then you'll tip to this side, and then you're going to have you hold your head there and don't let me push. Okay, so we have some very strong muscles and some very weak muscles. All right. Now we'll also turn rotation, and she indicated that this was problematic for her, it was painful. So I'll have her hold her head there and don't let me turn you. And if I apply a little bit of pressure, I can turn her head pretty easily. That should not happen. Okay. We'll try the other way now, and we'll have you hold your head there and don't let me turn you. Okay. And this side's even weaker. Would you agree? Mm-hmm. How much pain does it cause you when you actually try to resist?
Good amount.
Okay, good amount. All right. No, it's not. She's not enjoying herself. So I'll stop belaboring this point. Now, oftentimes what you want to appreciate is, in the absence of trauma, the body breaks down on the inside before it breaks down on the outside. Thinking or keeping that in mind, you want to understand that the neck is going to be a symptom of something else. Oftentimes we find that the gallbladder and liver are challenging, and that tends to cause the neck to break down. So if you wanted to apply we just did some kinesiology, some muscle testing. If you want to apply some kinesiology or applied kinesiology, you would then maybe find a reflex point. So the liver reflex point is right there. So I'll have you put two fingers on there. This is just an example of how you can use the what are called viscerosomatic reflex points on the outside of the body that reflex out to the outside. So it gives you a window of the dysfunction on the inside. So applying a good amount of pressure there. And then I want you to drop your chin down and then hold it over there. And I want you to hold your head there and don't let me push. And tell me how strong you feel.
Not strong.
You didn't feel strong?
No.
Okay, that's interesting because your head didn't move. Okay. And I applied a lot of pressure. So hold your head there. Drop your chin down. Does that hurt you?
No.
Okay. And I want you to put a good amount of pressure on that reflex point. It's going to be tender. Hold your chin there and hold strong. Now, I don't know if you can sense how much pressure I'm applying, but I've gone from 5, which made your head weak before, to a 50 at least, and you're holding just fine. Okay? Does that make sense? All right, you can relax that hand. That's just an example of using viscosomatic reflex points. And Sasha is relishing this opportunity to be on camera. Kidding. She's mortified. But she's a good sport, and I really appreciate her help, because this is hard for me to demonstrate on myself. It'd be kind of challenging. So just keep in mind that we already know that she's got weakness in her second core. We already know that that can be reversed by stimulating a viscosomatic reflex point. Now, she can't necessarily just walk around stimulating her liver reflex point all day long. Like, oh, I'm feeling fine, and I'm standing up taller, and I'm walking stronger, and I can turn my head just fine with no pain. It would help, but it's not going to get to the root cause. We'd want to find out what kind of stresses are going on. Is it too much toxins in the body that can't get out? Is it stress? Is it a combination of both? Is there hormonal stuff? You know, being a woman, I'd ask her if she's menstruating, things like that. All kinds of questions that we talk about in the privacy of a consultation or in treatment, because this is important stuff, because it's affecting her life. If she has chronic neck pain for several weeks, it's going to limit her enjoyment of life, and she's not going to get the most out of it. Does that make sense? Good. Any problems with weakness, numbness, or tingling in the hands?
No.
Okay. Falling asleep, arms falling asleep at night? Okay, all right, good. So what we can do then, of course, is we can ask a different type of muscle test. And most people ask, how do you muscle test and how do you show us that? It's really difficult, but we'll use the hand as an example, because Dr. Omura, which is a Japanese physician, actually has a US patent on this type of test. It's called a bidigital O-ring. So I'll have her hold her fingers together nice and strong, and I'm applying a lot of pressure to open that, and it doesn't work. So what I'm just going to do is I'm going to ask her to tip her ear to the shoulder, and that causes pinching over here still, yes? Mm-hmm. Okay, so hold these together and don't let me open it, okay? Now, I'm applying very little pressure, and it's showing that by tipping her head to the right, it's causing enough pain and stimulation in her nervous system that's weakening muscles, okay? So that's just a simple reaction. That's called a reactive muscle. All right, so we would call that a positive reflex. Now we could go through and test the rest of the muscles. What I would do now that I understand what's going on, is I would actually strengthen the neck flexors, okay? First and foremost, we know we have a biochemical reaction that needs support with the liver. That's going to help the neck get stronger. We can then go about strengthening using something like trigenics or some other type of kinesthetic work where you're actually stimulating the muscles and using movement and breath and things like that. We can ask if her shoulders are being affected by her neck. We can check range of motion, and if any of this causes you pain. Doesn't cause you any pain, right? Good. So what we can do is we can also check if people come in with weakness or trouble in their arms and stuff like that, we can check some different nerve roots, okay? And once you study a kinesiology, there are different nerve roots you can study. So we'll check this nerve root here. This is for the biceps, so just hold your arm here and don't let me push. That's nice and strong. And we're just going to put her in a position that's painful and then have her hold her arm again. Don't let me push, okay? Now, if you heard that crack, that was her elbow. And what you want to take away from that is I was just testing her bicep, you know, just as if she were to go out and pick something up, a grocery bag, go to the gym, do whatever. By simply tipping her head to the side, it weakened that nerve root enough to cause a potential injury down the road. Now, the bicep's not the issue, because if I test it in the clear with nothing else impacting, just hold there and don't let me push, and that feels plenty strong, right? But as soon as she tips her head to one side, just say she reached down to pick up a bag and then lift it up, she could strain that muscle by compressing the nerve root in her neck because of the tension she's got going on elsewhere in her body. So hopefully that makes sense. If you have any clarification on that, just give us a call and we'll give you the information. But this is just a simple way of evaluating this. One doctor is different from another, and you're never going to, as I said before, you're never going to go wrong by getting adjusted. It's always going to help. It's going to help calm the pain down. It's going to help restore function to the joints. But you always want to figure out what is causing the compression. So for example, the muscles that come off the neck down here and attach at the head, they'll basically turn you into a turtle in a shell. They'll basically cause this movement or this motion and hold you there because of the tension in the neck muscles. So again, as we said before, we could go through and do some type of adjustment. It might be an anterior, it might be a posterior adjustment. We could do some strengthening exercises where we might have her tip down and shorten the muscle, because this is called your SCM, your sternocleidomastoid, which is just a fancy word for one of your neck muscles. And we might stimulate that muscle, affecting some tendons, and then we'd have her exhale and rotate around and go back like that. What we'd want to be doing is strengthening. Once we strengthen all the muscles and everything was strong, then we'd want to figure out what was short. We'd want to lengthen that. That's all trigenic stuff. It's all mild neuromedicine and things like that. Again, you can adjust the joints, you can do the muscle work, but ultimately you're going to want to get rid of the stress or the toxins or whatever it is the imbalance inside the body that's causing the neck to go or be a problem in the first place. So, do you have any questions about what the root cause of your neck pain is?
No.
Okay, it seems pretty simple, pretty straightforward.
Crystal clear.
Yeah, so weakness in the muscle as a result of internal dysfunction. So we got to clean some house. Different topics we can talk about later, different methods, whether it's nutrients or therapies, using coffee and things like that. Everybody knows that favorite one. So not necessarily what Sasha would do, but some people might need that for getting rid of headaches, migraines, and other toxicity in the body. So let us know what your area of pain is, what your area of dysfunction is, and we'll be able to touch on that. We'll be able to let you know. Look forward to future videos where we're going to talk about low back pain. We're going to talk about weakness or numbness in the hands, things like that. We'll talk about thoracic outlet syndrome, people that have problems in their feet, knees, ankles. It's all connected. There's nothing in your body that happens by chance. Everything happens for a reason. So let us know what area of your body you'd like us to talk about so we can help you understand what the root cause is of your pain and dysfunction. And we'll be looking forward to seeing you soon.